Good day, class. In this video, we are going to talk about the liver. The liver locates in the abdominal region below the diaphragm on the right side of the body. The liver meridian connects with the gallbladder. The eyes are the orifice of the liver. So for the eyes problem, we can focus on the treatment of the liver. There are two functions of the liver. The liver governs the flow of qi. The liver stores the blood. When talking about the flow of qi, we actually refers to the qi movement. The movement of the qi, either normal or abnormal. The abnormal situation can either be excess, move too much, or lack of movement. So it either be too much or not enough. The movement of qi. This flow may affect the movement of the axons, the blood, the body fluids, the qi movement of the spleen, the excretion of bile, and emotions. As all these movements will rely on the qi movement. For instance, previously we said that one of the functions of the spleen is the transportation and transformation of the food and water. The clear parts of the food or the water is transported upwards, and the cloudy parts is transported downwards. In this process, something is moving upwards, and while the other is moving downwards. In the spleen function, something moving upwards, something moving downwards. In this process, this function is achieved with the assistance from the liver, regulating qi movements, this function. As you can see here, when we study the heart, we mentioned the heart function, we mentioned the heart only. Then when we talk about the lung, some of the lungs function are linked with the heart function, such as the peteral qi. We assist the movement of the blood. When it comes to the spleen, some of the spleen function are related to the heart, the lung, the spleen. And now when we study the liver, you will see that the liver's function actually related to all different organs. Because the qi, the blood, are linked to all organs. The human body is a whole system. We see the human body as a whole, and all these organs are linked together by means of achieving the physiological activities. We only separate them when we are studying. After studying all of these organs, we will need to place them back and see these 5 Zang organs as a whole. Therefore, the functions of specific organ are linked with the other organs. In order to achieve the activities, we will need the assistance from all different organs. When we come back to the qi flow of the liver, either excess or lack of a movement, when the flow moves too much, for example, excess anger, the patient feels angry, results in the liver fire. The patient may present with irritation, insomnia, red facial complexion, red eyes, chest tightness, distending sensations in the breast, especially in females. Or if the flow is lack of movement, we call it stagnation. The patient will present as depression, distending sensations in the chest, breast, or on the either side of the abdomen. So the diseases of the liver in terms of the qi movements will mainly present as these two aspects with specific content such as the blood, as the normal movement of the blood is related to the qi. That is what we call the heart qi, the lung qi, more specifically the pectoral qi, and the spleen qi. The lack of qi movement will slow down the movement of the blood, which results in a blood stasis. Patients may present with pain, tumor, delayed menstruation, dysmenorrhea, or even amenorrhea. With the excess qi movement, the patient may present with bleeding, such as cough with blood, or vomiting with blood, or excess bleeding during the menstruation. As you can see the examples from here, when we talk about the abnormal movements or diseases of the liver in terms of the qi movement, specifically on the blood circulation, we're going to discuss in two aspects: the excess movement of the blood or the slow movement of the blood, so either bleeding or blood stasis. Similar phenomena can be seen with the water metabolism. The excess movements or lack of movement, such as the patient may present with dry skin, dry stool, dry tongue, and with the lack of movements, the patient may present with edema or the phlegm. The phlegm can be the visible phlegm that the patient can cough out, or the invisible phlegm. In future, when we study the phlegm, we're going to explain what kind of phlegm is considered as invisible phlegm. But no matter which phlegm, visible or invisible, these two are the results of the abnormal movement of the water. So in the treatment, we're going to in the treatment of the phlegm and the blood, especially the bleeding, we're going to focus on regulate the qi movements, regulate the liver qi movements. When we talk about the bleeding, especially the bleeding in the lower part of the body, we have mentioned that we are going to focus on the spleen. The spleen controls the blood, especially in the lower parts of the body. Bleeding here, more specifically, is for the bleeding in the upper parts of the body. So nose bleeding, vomiting blood, coughing blood, we're going to focus on regulate the liver qi. The function of governing the qi flow also can be reflected in the digestive function of the spleen and stomach. The spleen governs the rise. The digestive function is the result of the spleen and stomach functions with the assistance from the bile. The liver qi promotes the digestive function in terms of promoting the spleen and stomach function, as well as promoting the excretion of the bile. So if this function has been affected, if mainly focused on the spleen, the patient may present with poor appetite, bitter taste in the mouth, jaundice, distending sensation in the abdomen, or abdominal pain, even gallstone. The patient also may present with diarrhea, vomiting, poor appetite, or even fever. If this qi movement is mainly focused on the stomach function, the patient may present such as stomach ache, chest press, poor appetite, nausea, even vomiting. Apart from the above, the emotions are regulated by the liver qi flow. Although different emotions belong to different organs, which is controlled by the heart, as the emotion is a part of the thought or part of the spirit, or in an even broader sense, because part of the mind. The heart houses the mind, so the emotion is under the control of the heart. However, in the emotion, the liver qi plays an important role, as the emotions are the result of different qi movements, and the emotions may further disturb the qi movement. For instance, as described in the 黄帝内经, anger will cause the qi moves upwards. That's why when you feel angry, you have that kind of feeling or the kind of hot sensation in your head. So when you feel angry, you don't feel the hot sensation in your feet, but you can feel the hot sensation in your head. From this phenomenon, in Chinese medicine, we think that the anger will cause the qi move outwards, as the qi is kind of energy. The qi has one of the function of warming. When excess qi move outwards to the upper part of the body, you will feel the hot sensation. So anger will cause the qi move outwards. Fear will result the qi move downwards. Can you find any examples that the fear will result the qi moving downwards? For instance, your pets or the dogs in your house, when they feel fear, when they were afraid of something, the animals will pee. This is the urine moving downwards. So the qi move downwards. Sorrow will present as lack of qi or qi deficiency. This is also something we can see. Someone feels sorrow, they always tired and fatigued. This is a situation we call qi deficiency. So the normal emotion will rely on the normal qi flow, which is governed by the liver. When talking about the reproductive function in humans, it mainly refers to the accretion of the sperms and eggs. Although these functions in male and female are more related to the kidney, however, the movements of the sperm and the movement of the eggs, even the menstruations, are related to the qi movements, similar to the above. Thus, if the qi doesn't move regularly, the patient may present as such as the irregular menstruation, amenorrhea, painful menstruation, or dysmenorrhea. In male, if the excess movements, the patient also may present as spermatorrhea. The above is some of the examples of the liver governs the flow of qi. The other function of the liver is the liver stores the blood. This means that the liver has the functions of storing blood, adjusting the volume of the blood in the circulation, and preventing bleeding. Firstly, storing the liver qi. The liver blood is the foundation of the liver qi. The blood is yin, which is the part of the static, quiet. This can prevent the excess movement of liver qi. So from here, when we consider the liver qi and liver blood, again, we're going to see from the point of view, the yin and yang. The liver qi is yang, the liver blood is yin. The liver qi is active. So these active movements need to be limited by the liver blood. The liver blood can help to reduce the movement, can store the liver qi. This can help to prevent the bleeding. The second aspect is the regulating the volume of the blood. According to 黄帝内经, it says that the blood moves to the liver when we are lying down. From this statement, we understand that the liver and the vessels are similar to the lake and rivers in the nature. When there's extra water, the water will travel to the lake, and the water in the lake can move to the river as well. From this perspective, in order to maintain certain volume of the blood in the vessels. For the circulation, it will rely on this function of the liver, which assists in adjusting the volume of the blood. The blood is the foundation of all tissues, physical body. As stated in Huangdi Neijing, when the eyes receive blood, we can see. When the feet receive blood, we can walk. When the hands receive blood, we can grab. As argued by the classic, the physical activities of seeing, walking, and grabbing something is due to the nourishment of the blood. Therefore, the blood stored in the liver may nourish the eyes, the ligament, and the liver itself. The blood stored in the liver is the source of maturation. Thus, the liver is called the sea of the blood. If the patient presents as a blood deficiency, they may present with less blood in the maturation or even amenorrhea. The last significance of the storing blood is to prevent bleeding. This function is achieved with the assistance from liver yin and liver yang, the balance between liver yin and yang. From this point of view, the liver stores the blood. The dysfunction of storing blood will cause all kinds of bleeding, such as coughing blood, vomiting blood, excess bleeding in the maturation. However, because the bleeding, especially in the maturation, it is considered as the lower part of the body, so it also can be the result of the spleen deficiency. So in our practice, when we see patients with excess bleeding in the maturation, we need to clarify, is it from the spleen or liver? From the spleen, that's due to the spleen deficiency. The spleen loses the function of controlling blood within the vessel. That's due to the deficiency, the patient may present with the other symptoms, such as pale complexion, pale tongue, swollen tongue, loose stool, fatigue. And when excess bleeding in the maturation due to the liver, especially if due to the liver fire, the patient may present with the other very different symptoms. These symptoms are due to the heat, such as the red facial complexion, the red tongue, yellow coating, bitter taste in the mouth. These are all indicating that the cause of this disease is from the liver, especially from the bitter taste, the red appearance from the facial complexion and the tongue. Anger is the emotion of the liver. Anger will directly affect the liver qi, especially the flow, the movement of the qi. It will result in the qi moving outwards. In this situation, in some condition, the patient may present with such as stroke. So after anger, this we actually can see in our daily life, or more commonly, we can see in the episodes in the TV. So in the family, when they argue, when they fight together, the anger, after the anger, and then all of a sudden, one of the family members fall down. That's the stroke. Why the phenomenon presents like this? That's because the anger will cause the liver qi moving outwards. The excess liver qi moving outwards will cause a blockage in the brain. That's where the stroke comes from. It also can cause the bleeding. It may be the ischemic stroke or bleeding. Both of these two symptoms are the results of excess movement of the qi flow. Actual qi moving upwards may result in the bleeding or the blockage of the upper part of the body. The tears are the body fluids of the liver. So if a patient presents with conditions with the tears, we may treat the liver. The treatment will be focused on the liver, such as the no tear or excess tear, tearing eyes. Then we will focus on the treatment of the liver. The sinews or ligaments as the body constituents of the liver. Nails as the splendor. So the splendor, you can see the nails condition to reflect the liver condition. The sinews or the ligaments are the body constituents of the liver. Thus we can see, for example, the senior people, they walk slower, their movements are not that flexible. In Chinese medicine, we think that the sinews or the ligaments are not that flexible because of the age, and this will result in liver deficiency, especially the liver blood or liver exons deficiency. So in the treatment of these sinews or something related to the ligaments, we also will focus on the liver. The eyes are the orifice of the liver. In the meridian, the liver meridian links directly to the eye. So the liver axons, the liver blood, need to nourish the eyes in order to see. This theory, the eyes are the orifice of liver, has been developed into the five-wheeled theory. In future, when we study the diagnostics, we will discuss the eyes diagnosis. How to diagnose from the eye which parts of the eyes can reflect which organ. The liver corresponds to the spleen. This is from the phenomenon that in spring the trees is growing, everything is growing, everything is moving forwards. The moving forwards, this movement is similar to the liver's function, the qi movements. The qi need to move forward. So the liver corresponds to the spleen, and in spleen we can nourish the liver. Some diseases that are related to the liver are more likely to happen in spring. In this video, we mainly focus on the discussion of the liver. There are two functions of the liver, which are the liver governs the qi flow, the liver stores the blood. Because the qi and the blood relates to all over the body, and these qi and blood are actually refers to the qi and blood of the whole body. So the liver, the function of the liver is related to the different functions in different organs of the whole body, such as the emotions, blood, the water metabolism, the digestive function, the emotions, reproductive function. The eyes and ligaments, miniaturization. As you can see, the liver relates to many different kinds of aspects. This also can be seen in practice. In our clinical practice, we can see many diseases that's due to the liver dysfunction. This liver dysfunction, we still need to be careful that the liver in Chinese medicine is not the liver in anatomy. So when we said the liver dysfunction, you're not only going to see the blood test. We more focus on the whole function of the liver by means of the qi flow and storing blood. In this video, we are going to talk about the kidney. Thank you for your attention.